coordinated or hosted by the Water Research Commission of South Africa, by the IORA RCSTT, as I've mentioned, in Iran. And we also have our partners on board who are the Department of Science and Innovation in South Africa, the IORA Academic Group, and also our Department of International Relations and Cooperation. And we thank all the partners for board and our speakers for your availability. We have quite a long program today, so we will try to manage our time so that we are able to still finish within the allocated time. And then just a quick house rules is, firstly, we'll ask all the participants to always keep your mics muted and your videos off, and only, even with the speaker, so only when I introduce you as a speaker, you are now allowed to switch on your video and your microphone so that you can be able to speak. In our program, we have allocated some time for Q&A, and I'm hoping that we will be able to manage the time such that we are able to still provide the Q&A session so that we can also hear from you, our participants, during the conversation. So kickstarting the program, we will start with the first speaker, and the first speaker is going to be Mr. Desigan Naidu, who is the CEO of the Water Research Commission in South Africa, to address us and to give us some welcoming remark before we kickstart with the program. Desigan, over to you.
Good morning. I'm not seeing myself on the video. Let me try that again.
I'm also not seeing
this. Okay.
See you.
That seems to be better. Okay. Thank you very much. And good morning to all the colleagues from IORA. And this is quite a landmark engagement. And we welcome all of you, but maybe a special welcome to Dr. Miramadi. We're now on the other side of a screen as opposed to when we last met. But this is our new, more normal, of course. And then the other speakers, Mompe Chaba, Nanya Bolamulla, and Dean Malcolmson from DERCO. Colleagues, I think it's fair to say that the world as we had known it has changed very fundamentally. Perhaps in more ways than we currently acknowledge. It has changed us from a health perspective, or from a social perspective, from a psychological perspective, from an economic perspective. It is clear that the world is in a very different place. In fact, some people have written quite dramatically about this, and one of the ones that's making the rounds currently is Arundhati Roy, who is talking about the pandemic as a portal, that this is the moment we are going to remember for future generations when we went from one way of doing things in the world to a completely different one. It's a bit of a frightening prospect. It has challenged all of the things that we considered as mainstay in the way we were doing things. It calls for a high degree of agility. It is also possible that the world will be a better place. So what we are doing today is building on a very important webinar that was held in May under the auspices of IORA, talking to COVID-19 and the engagements that we need to have as the IORA community of practice, responses, cooperation, and partnership. I think it's been quite clear throughout this pandemic, wherever we were in the world, of the primacy of science and innovation in leading the way, in helping us to understand the nature of the pandemic itself, in organizing for us to have the best responses medically and health-wise and socially around this, and the primacy of water in particular. I mean, water and the hand washing campaign has become the first line of defense everywhere in the world as we see it. It has also, in the course of that, highlighted the importance of water in recuperation and recovery. And then more recently, we have become quite adventurous, and this is something that we'd like to discuss with you in much more detail in the next engagements that we have. And that's around how the water and the water system can serve as an incredibly important epidemiological indicator of the progress of the pandemic. And this is something I will return to very shortly. But what has happened in this domain with the primacy of water and the primacy of sanitation in the course of the epidemic, it has highlighted in a way that we can no longer ignore the disparities in different parts of the world. That by and large in the developing world, and all of the scorecards around the SDGs are pointing in this direction, is that we are far behind the curve of where we need to be around reliable access to clean and safe water, safe and dignified sanitation all over the world. The backlogs are enormous. It appears at this point in time reasonably unlikely that we are going to make the 2030 target around water and sanitation as they are described in SDG 6. So on the back of this, and with the recognition of that, the global community has actually responded in a very meaningful way. Not too long ago, the United Nations Secretary General, Antonio Guterres, led the UN's response to this, supported very strongly, of course, by UN Water, in the form of the Global Acceleration Framework. And he also launched at the same time the Decade of Action of 2020 to 2030, and using the Global Acceleration Framework and the actions associated with the Global Acceleration Framework to organize for us to get, if not at the target itself by 2030, then very, very close to it. It's quite significant that this Global Acceleration Framework pulls out 5 pillars as the pillars that will drive this accelerated engagement, this accelerated delivery over the next 10 years. 2 continue to be mainstays. The first one being finance and organizing for the right investment mechanisms, but also new models around how to access finance around the WASH agenda in general, but the developmental agenda for water and sanitation in particular. The second of those mainstays is governance, and governance beyond structures, of course. And structures are, of course, an important part of this. And we had a very good session during World Water Week last week, re-engaging the concept of what national water laws need to look like in order for us to be able to get to the crux of the engagement around universal access to water and sanitation on the one hand, but on the other hand, organizing for water to be a building block, an accelerator to economic recovery and economic development in all of our countries. So governance and the framework of governance, the policy, the regulatory environments, and the interinstitutional relationships become particularly key. In the context of where our own community of practice and the Indian Ocean Rim, a very key part of the governance is around engaging what the multilateral governance mechanisms need to be over and above the coordinating mechanisms offered by UN Water. And this is particularly critical in the time where, in addition to the crisis around COVID, we know that there are 3 other horses to this apocalypse as we engage it. One is the continuing climate crisis. The other is economic recession in the world. Some are saying the worst since 2008. Others are saying even worse than that. This is, in parts of the world, more significant than what had happened during the Great Depression. And then, of course, it is a new multilateral model that the world requires, because the current multilateral model is at risk. So organs like the Indian Ocean Rim Association become incredibly important tools around rebuilding a new model for multilateral engagement in the world to help us to go forward. The 3 others are: 1, capacity and capability inside the system. This is about more than human resources. It is about different models around how to access capacity in a modern world. It's about the transitions around different worlds of work, as we are already experiencing it in this very webinar, and having the capability to be able to engage that in a much more robust way to organize for our development agenda. But the 2 that are frankly quite new in the United Nations speak are the ones that I think we want to put our best foot forward on. 1 is data and information. We are living in a digital age. Indeed, one of the reasons why this pandemic has the kind of airtime that it has currently, firstly, is that the modern world did not expect such a crisis of such proportions that we would not have the ability to deal with. In the 21st century, I'm sure that before this crisis, we did not think we would not be able to deal with a global pandemic, and here we have it. Secondly, around that is the fact that those countries that have the highest preparedness index in the world around this kind of epidemic are in fact the first places in the world that had the most severe infection rates, and some of them are still failing to get out of it in a reasonable kind of way. But I think it's clear that data and information have to become a fundamental part of our toolbox in the way we engage moving out of this pandemic, and indeed getting back on the road of the acceleration framework to getting the SDG 6 firstly banked, and then preparing for the 10 billion initiative by 2050, and then for the economic recovery of the world as a whole in a sustainable development paradigm. The fifth pillar is a crucially important one. It is innovation. It's about accepting that we cannot continue to do things in the way that we had been doing it before. Where we are requires us to do things differently, and it requires for us to do different things. And this is absolutely crucial. So colleagues, where we're sitting at, and I want to emphasize this point, is that we have a community of practice in the Indian Ocean Rim as part of IORA that has the ability to organize for ourselves, to better organize our cooperation, better organize our sharing around knowledge and information, better organize our efforts around innovation in order to organize for ourselves to go to SDG 6 by 2030 and beyond. And some of the things that we have to engage is organizing to make the best use of the current knowledge that exists in the world. And I'll organize for two examples, two very brief examples. The first is non-sewage sanitation. For the first time, led largely by the developing world, we have a new sanitation standard in the world. We have ISO 3500 that organizes for the first time to have standards around non-sewage sanitation. Why is this crucial? The reason why it is crucial is because the waterborne edge of the world as a whole has extraordinary limits to it. That to get beyond these limits into universal access to sanitation and indeed wastewater treatment is decentralization. It's around moving to localized systems. It's about going off the water grid, if you like, into the non-sewage sanitation domain. And then closely related to this is around us reorganizing the way we think about wastewater treatment. Because wastewater treatment now needs to be about beneficiation. It now needs to be around energy generation. It now needs to be about value add. It now needs to be about new business and economic models to organize for the extension of services. Colleagues, we are at a unique place in the world. We have a fluid space, an opportunity to turn the old paradigms completely on their head. And I believe that our ability to get together as an IORA team can help to lead other parts of the world into a much more sustainable future. So I want to conclude on those few remarks, and I'm looking forward to both the sessions that are going to follow after these remarks, as well as the future webinars that we have already planned. And it's wonderful to see all of you again. Thank you very much indeed.
Thank you very much, Desigan, for those welcoming remarks, and reminding us that the real aim of this coordination center that we are now coordinating or facilitating as a Water Research Commission is to make sure that we provide opportunities for the IORA member states and the dialogue partners to share the knowledge, the data, the experiences, the best practice, but we're also here to make sure that we provide platforms for joint learning between the members, and lastly, to co-create new knowledge, but also co-creating solutions and sharing solutions that are available in water and sanitation that could benefit the IORA member states and the dialogue partners. So thank you so much, Desigan, for that. And then we'll move to the next speaker. The next speaker is Dr. Tahirem Rimadi, who is the director of the IORA Regional Center for Science and Technology Transfer, RCSTT, in Iran. And as I've mentioned, they are the co-host of this webinar with us. The first one that we are doing with the hope of doing the second one in September on the 30th. And in the one on the 30th of September, we will be talking about the kind of research programs and projects that the IORA member states and the dialogue partners have put in place to respond to COVID. So in this first webinar that we are doing as the co-host, would like Dr. Mirimadi to also come and give us some opening remarks. Thank you. Over to you, Doc.
Thank you very much. Mr. Desigan Naidu, CEO, WRC South Africa, thank you for your very beautiful
sorry, Dr. Mirimadi, I just missed your audio there. Just check if you are not muted. I cannot hear you. Tobile, can you hear? You are muted. We can't hear you. Tobile, can you help to unmute Dr. Mirimadi? Because we could hear you in the beginning, but you weren't muted. Tobile, are you able to assist from your side? Dr. Mirimadi, just wait a bit. Don't press anything. Tobile will try to unmute you from her side.
She is unmuted, Ma'am Claudine.
She's unmuted?
Yeah. But maybe she didn't join in with the audio.
But we could hear her at the beginning.
Yes, I know. I don't know what went wrong now.
Dr. Mirimadi?
Okay, Ma'am Claudine, I'll suggest we move on to the next speaker and then I'll try and sort it out with Diane.
Yeah. I'm thinking that she's probably trying to
I think she didn't join with the audio. She didn't enable her audio. She just needs to leave the meeting and then join again.
Assist her offline, please. Thank you.
Okay, thanks.
Okay, apologies, colleagues. We will move to the next speaker. Dr. Mirimadi will come after this next speaker is going to speak so that we do not waste the limited time that we're having. And then our next speaker is going to be Ms. Mambe Chaba. Mambe is the Chief Director for Multilateral Cooperation in Africa in the Department of Science and Innovation in South Africa. And Mambe will just come and give her remarks as one of our main partner in this coordination center that we are hosting as the Water Research Commission. Mambe, over to you.
Thank you very much, Program Director, Dr. Mamhloding Tlhagale. Good morning to all of the participants and in particular representatives from the IORA member states that have taken the time from your busy schedules to join us today. Good morning to all of the speakers as well on the program, Mr. Desigan Naidu, the CEO of the Water Research Commission here in South Africa, Dr. Tehere Mirimadi, Director of the IORA Regional Center for Science and Technology Transfer, RCSST in Iran, Professor Nanya Bola-Meller, the SAIOR Academic Group Coordinator, and Mr. Malcolmson, Chief Director, Regional Organization at the Department of International Relations and Cooperation here in South Africa. Congratulations to the WRC and the IORA RCSST in Iran for this inaugural joint virtual session. As the coordinator of the South African chapter in the Indian Ocean Rim Academic Group, the DSI welcomes this collaboration, which brings together IORA member states to discuss critical issues in an effort to find and implement solutions. With the global statistics now at over 25 million confirmed COVID-19 cases and over 850 confirmed deaths due to COVID, for South Africa, the situation is just as dire. We have about 625 confirmed positive cases as of today, and just over 14,000 deaths. It is at this time that science, technology, and innovation seems to be the only hope to provide answers and solutions to address this pandemic. One can even say that it is time for science, technology, and innovation to shine, a time when the worldwide coronavirus pandemic compels policy and decision makers to employ scientific and evidence-based solutions and novel approaches in response to the virus, to this pandemic. Both national governments and multilateral bodies are prioritizing STI to provide solutions. A number of member states have consistently invested in STI over the years, and these types of countries that have invested in STI have been shown to deal better with the pandemic and are able to provide a comprehensive, multifaceted response to the pandemic. As early as March 2020, our President, His Excellency, Mr. Cyril Ramaphosa, announced the establishment of a National COVID-19 Command Council, which is constituted by renowned scientists and experts from diverse disciplinary fields to make a formidable transdisciplinary committee that would provide advice to government in its response to the pandemic, which is anchored on the evidence provided from scientific research. The UN Secretary General has reiterated that history will judge the efficacy of the response to COVID-19, not by actions of any single government, but by the degree to which responses are coordinated globally across all sectors of the community. This has been reiterated also by our President, who in his role as the chair of the African Union has stressed that only a united and coordinated response underpinned by the principles of Pan-African unity and solidarity offers Africa the best possible chance of containing the outbreak. The Department of Science and Innovation has taken swift action to respond to this call, drawing on a portfolio of initiatives and programs built over the years with regional, continental, and international STI partners to respond to this pandemic. I'll just give 4 examples in brief of how South Africa has taken the initiative to contribute to a continental response. Firstly, through our National Research Foundation with the support of international funders, the COVID-19 Africa Rapid Fund was launched in May 2020. This has seen partners from across the continent and the globe committing approximately $5.4 million towards the fund to support about 75 research and science engagement projects across 17 countries for the next 2 years. The second example is a partnership with the African Union and the International Science Council to establish the African Platform for Science Advisors. This is a platform that aims to increase a pool of capacitated and informed African science advisors that can lead the continent's development. The third example is the European and Developing Countries Clinical Trials Partnership, the EDCTP, which launched a call in April, focusing on interventions to support research activities in sub-Saharan Africa to manage and prevent the spread of the COVID-19 outbreak. The last example is an African Medicines COVID-19 research team, which was established, and it comprises of scientists and experts from universities, science councils, healer organizations, and technology incubators. This team is studying a number of South African and continental herbs and formulations which have been documented as evidence for the treatment of respiratory infections, and is going to make a couple of announcements in the next few weeks based on the findings that they have made. At national level, the Department of Science and Innovation has put together a number of initiatives. And because these are numerous, I have just picked the following 3 as examples to share with you this morning. A COVID-19 vaccine production task team has been established, which aims to get South Africa into a state of readiness to manufacture an approved COVID-19 vaccine locally in anticipation of the huge demand. And should a vaccine be approved, manufacturing facilities will need to be established in different regions. And Africa as a whole will also need to be ready to manufacture these drugs to reduce the costs of access to medicines. The Council for Scientific and Industrial Research, as the CSIR, have repurposed their laboratories to conduct COVID-19 testing in support of government's drive for massive testing. The Product Development Technology Stations at the Central University of Technology has developed personal protective equipment. They're manufacturing PPEs, including an airway protection device for healthcare workers. The technology station has applied for approval and for an amended license to accommodate the new products under its existing ISO 13485 certification supported through our Technology Innovation Agency. Two last examples. The ENSA Innovation Hub at Nelson Mandela University is using additive manufacturing, that's 3D printing, to produce face shields, frame designs, and modifications to enable clinicians to easily replace your standard transparent sheet without the need for punching holes and adhesives, etc. Designs are now available through open source networks, and ENSA has now also positioned itself to provide support to various projects within the country. The last example, the telecommunication chemicals at Tshwane University of Technology has begun production of its first 5,000 containers of hand sanitizers that are distributed to staff and are placed at strategic points across campuses within its structures. So these are just a few examples, but I just want lastly to touch on the role of water and sanitation. Water and sanitation has become the most effective and most affordable way to respond to the pandemic. Water, just like science, knows no borders, and due to the scarcity of this resource, it can cause wars if it is not well managed. It is a diminishing resource which fortunately can be recycled. Water is also a common binding resource that brings the IORA member states together and needs to continue priority in the IORA research agenda. Particular issues for cross-border partnerships and collaborations need to focus on building resilient water infrastructure, continuous maintenance of such infrastructure, ensuring an adequate supply of trained personnel to manage this infrastructure is critical to ensure that an enabling, safe environment for sustainable and resilient facilities are created for Africa's development. Resilient infrastructure plays a critical role in 3 pillars of sustainable development: the economy, the environment, and the society. Sustainable Development Goals 6, 7, 9, and 11, so 4 SDGs, explicitly highlight the critical role of infrastructure for building resilient communities. This is where the water, sanitation, and hygiene centers of excellence, the WASH centers, can play a role and promote partnerships and collaborations to achieve the SDGs as attained, and to ensure that the SDGs are attained through partnerships. It will not be possible to attain these SDGs without partnerships, and I therefore, as a representative from the Department of Science and Innovation, would like to encourage this continuous engagement and dialogue between IOR member states to ensure that we collectively, in a comprehensive manner, respond to our challenges. And with that, I thank you and look forward to a really engaging, dynamic session this afternoon. Thank you so much.
Thank you very much, Mrs. Chaba. We'll move straight to Professor Nanya Bola-Muller, who is in the South African IORA and from the Human Sciences Research Council, to also give us her remark. Thank you, Prof. Over to you.
Thank you very much. And I wish to thank the Water Research Council, as well as the Department of Science and Technology and the Regional Center for Science and Technology Transfer for inviting me today. Yes, I am still involved in IORA. I was the chair of the academic group for 2 years when South Africa chaired IORA. And it is a tremendous honor again to be engaged and involved specifically in this very important topic. The Human Sciences Research Council has been actively involved in a number of projects around COVID-19. We have been contributing towards the national priorities and looking at issues such as the WASH initiatives. So I would like to speak a little bit about South Africa's situation in terms of water. The reason for this really is so that we can learn from one another, and you can assist us in improving our responses to COVID, especially when it comes to the accessibility of water. We are facing not only a pandemic at the moment, we are still facing climate change. And climate change has led to droughts in many parts of the world, including in South Africa. In South Africa in particular, we have a dire situation where since 2016, the number of households that have access to piped water has reduced by 11%. Reasons for this include droughts, lack of maintenance, as well as situations of corruption. Our Constitution recognizes the right of access to sufficient water and food. So we can't really separate the issue of water and food. And we are struggling tremendously with hunger during this time of COVID. We were a country that was struggling with hunger prior to COVID, but now it is far worse. Although the economy has started to open up as we move into level 2 of the National Disaster Management Act levels. So level 5 was the most severe lockdown, and level 2, we are opening up large parts of the economy. However, water remains a problem. And even though we have in section 27 of the Constitution a right to access to sufficient water, as I've indicated, this is not necessarily the case. The reason why this is very problematic is that there is also not sufficient water and sanitation in many schools. So children are meant to wash their hands regularly with soap and water, both at home and at school. And in many circumstances, they are unable to do so, especially in rural schools. This was one of the reasons why our schools were opened and then again closed, because of the fact that many school children would struggle at school with water and sanitation. So in South Africa, the South African Human Rights Commission collects data around access to water. However, they need to receive this data from numerous government departments, and unfortunately, there is not sufficient data to tell us exactly what the situation is in South Africa. But I can tell you something in terms of the data, and that is that only 46.3% of households in South Africa have piped water in their homes. Most other households have access to water outside the home, as well as outside sanitation outside the home. This means that communities living in informal settlements in particular need to leave the home, and therefore this is a major risk in terms of the spread of COVID. So the right to water is what we could also call, besides a socioeconomic right, a developmental right. And we need to see it as a form of social wage. It is also directly linked to the Sustainable Development Goals, as we've indicated, and 2030 being around the corner, there are certain concerns that we have that we may not attain this goal. The Water Research Council and the CEO, Designado, has indicated that we have put in place a number of different measures in South Africa to ensure that we do reach this goal. It's a lot to ask for in 10 years. So we need to look across IORA as a region, and we need to look at the strength of our multilateral organization, I think which Graham Anderson will be speaking about, to work together to resolve these issues. COVID-19 is a serious problem across the region. Some countries have succeeded better than others, and we also need to learn from those countries as to how they have been handling the virus. South Africa has fared quite well recently, but we are concerned that we are facing a second wave. And so we need to be particularly vigilant, because as the economy opens, it does not mean that the pandemic has not ended. It does not mean that the virus is still not with us. And as the economy opens, we have far more chances of infections. So our infection rates have indeed started to rise again. One of the most important factors, as I've mentioned, in preventing the spread of COVID-19, well, there are three really. The one is washing hands with soap and water. The other is social distancing. And the third is the wearing of masks. Social behavior is needed in order to deal with these issues. And so governments and civil society and the private sector need to assist us in order to see this behavioral change. And this includes a change in attitude towards water. Because we have droughts, we have to be careful about the way in which we use water. But at the moment, we have no choice but to ensure that we are regularly washing our hands in order to keep ourselves and others safe. Many countries in IORA are following the WASH program in order to ensure hygiene. This process begins at home with mothers, fathers, and children. Of course, that's where education really starts. But it is also important to ensure that this is part of schooling and school education, including at pre-primary schools with very young children. Because of the fact that we are facing this pandemic, of course, this is at the forefront of our minds. We want to make sure that everything and everybody is safe. However, this kind of contact needs to continue after the pandemic has left us. And that's going to be a while, I think. So it is a tremendous honor, again, I'd like to say, to be a part of this. And I would like to also ask other IORA countries to assist us in finding new ways, new technologies, and using new research in order to make sure that people have access to sufficient water, and also bring in the social sciences when we're looking at changing the behavior of people when it comes to hygiene. Thank you.
Thank you very much, Prof. Dr. Mary Maggie, I see that you are back online, but I'll kindly like to just move to Mr. Graham first, and then you'll be the last one speaking in the plenary session after Mr. Graham, if you allow me, please. And now I will call on board Mr. Graham Anderson. Graham is the Deputy Director at the Department of International Relations and Cooperation of South Africa, and also the Deputy Director responsible for the IORA relations at the ministry. Graham, over to you.
Thank you, Program Director, and I want to take this opportunity to also thank Mr. Naidu from the Water Research Council for convening this important meeting, and also the other speakers as well, and honorable delegates. Good morning, everybody. First and foremost, I need to apologize for Mr. Malcolmson, who would have delivered the opening remarks, but he has been called to participate in the selection process of our next Secretary General, which is quite an important thing. So he couldn't make it, so apologies for that. Honorable delegates, water and water management has become a priority objective of IORA, and in arguing for the inclusion of the matter in the IORA action plan for the period 2017 to 2021, South Africa has continued to stress the importance of this issue based on the fact that the majority of our member states are dry to very dry countries. This resulted in the establishment of the IORA Water Science and Technology Core Group in 2015. The Water Research Council of South Africa, which took the lead in the core group, received funding from the IORA Special Fund to host 3 workshops, and they are very well known. The one that was held in South Africa in 2015, then there was a second one in Sri Lanka in 2016, and the third, of course, that took place in India in 2017. The hosting of this webinar by the Water Research Council and the RCSTT on water, sanitation and hygiene and COVID-19 is therefore not only very timeous, but its outcome should also be accommodated within the Water Science and Technology Core Group. Honorable delegates, these are challenging times, but with challenges comes opportunities to enhance cooperation through stronger partnerships, effective coordination and planning. Until there is a vaccine or treatment for COVID-19, the only viable strategy to prevent the spread of this virus, our response plans at national, regional and global levels must therefore prioritize water, sanitation and hygiene services. As the world struggles to contain COVID-19 and mitigate its impact on our lives and livelihoods, it should be clear to everyone that international cooperation and solidarity is an important dimension in this battle. Therefore, it is fitting that this webinar takes place at a time when appropriate national responses are vital, and combined with regionalism and multilateralism, it is ever more important to tackle the devastating effects of this virus collectively. South Africa is a founding member of the Indian Ocean Rim Association and recently chaired the association between the period 2017 to 2019. In this respect, we have been diligent in supporting the growth and development of the association since the inception in 1997. The basis of the organization emerged out of former President Nelson Mandela's state vision during a state visit to India in 1995, and his vision has guided our collective energies that continue to propel IORA forward in the 21st century. The association has identified a number of priority areas that include maritime safety and security, fisheries management, academic science and technology cooperation, trade and investment facilitation, disaster risk management, tourism and cultural exchanges, with 2 cross-cutting focus areas of cooperation, namely the blue economy and women's economic empowerment. These priorities reflect the socio-economic opportunities and challenges within the region. The priorities have been carefully and collectively formulated to respond to the multidimensional challenges and opportunities of the 21st century. In many ways, therefore, the focus areas identify, summarize, and reflect the UN SDGs. In this regard, South Africa remains committed to highlight the importance of water and the management thereof as a crucial resource for economic development in the Indian Ocean region. The Water Research Council was identified as a potential IORA Center of Excellence in advancing this important theme within the Indian Ocean region, and as already mentioned, has taken the lead in the IORA Water Science and Technology Core Group. Therefore, we welcome the signing of the MOU between the RCSTT and the Water Research Council on 1 November 2018, which should further enhance the IORA regional research partnership in the areas of water and sanitation. The IORA Action Plan for 2017 to 21 calls for the strengthening of the RCSTT and supports the specialized agency in its task of promoting science and technology in the Indian Ocean region. And we are encouraged by the conviction displayed by member states and dialogue partners in working towards this objective. We know that pandemics affect the world's most vulnerable people the hardest. Therefore, we need to also reinforce our health diplomacy. Strengthening national health systems requires sharing of our experiences with other countries and learning from theirs, as well as placing a higher priority on health sector reforms in our development cooperation. The future of IORA is linked to the commitment of the IORA member states in ensuring that this important organization becomes a global voice for peaceful and sustainable development, and that its principles are premised on advancing multilateralism, particularly in the context of the current global environment, which is characterized by the rise of populism, protectionism, unilateralism, and nationalism. South Africa views IORA as an important platform for upholding the importance of multilateralism and global collaboration in resolving the intricate challenges facing the world. In this regard, we believe that IORA will remain a beacon of hope for multilateralism and regional cooperation at a time when the coherence and stability of the global multilateral system is being tested severely. IORA provides us with a unique opportunity to enhance the spirit of multilateralism with one of the most diverse regions in the world, comprising a heterogeneous mix of developed countries, developing countries, small island states, and least developed countries. As a collective, we should take this opportunity to expand on our understanding and mutual beneficial cooperation through IORA's consensus-based, evolutionary, and non-intrusive approach. In conclusion, therefore, I wish you well with these webinar discussions in taking forward the important priority of water and water management in the context of COVID-19 and sanitation and hygiene. We have much to learn from each other in order to best deal with the impact of this pandemic. I thank you very much.
Thank you very much, Graham. We will now move back to Dr. Mirimadi. I think she is now able to work with her audio. Tahere, yes. Are you there?
Yes. Do you hear me?
We'll hand over the floor to Dr. Mirimadi. As I had introduced her before, we had a technical glitch. She's the director of the IORA RCSTT, which is the structure within the IORA that has partnered with the Water Research Commission of South Africa to coordinate and facilitate activities on water and sanitation research, development, and innovation, as colleagues have spoken. Over to you, Dr. Mirimadi.
Thank you, Mama Holding. I'm sorry for the technical difficulty that I had earlier. My dear friends, Mr. Desigan Naidu, CEO, WRC South Africa, Professor Narina Bohler-Muller, Mr. Graham Anderson, thank you very much for your informative opening remarks. Dear participants, on behalf of RCSTD, it's a pleasure to co-host the webinar on water, sanitation and hygiene, WASH, and COVID-19, IORA member states' response to COVID-19 and beyond. This webinar is the result of extensive and intensive work of Water Research Commission of South Africa, IORA Secretariat, and IORA Regional Center for Science and Technology, RCSTD. RCSTD mandate contains promoting coordination, cooperation, communication in the area of science and technology, and enhancing knowledge sharing and capacity building within this sector among IORA member states. The cooperation between IORA RCSTD and WRC became official on the 1st of November 2018. The two parties signed an MOU to establish a coordination center on water and sanitation research and innovation. I am pleased to see that this cooperation yielded fruit in this very timely webinar. The provision of the safe water, sanitation, and waste management and hygienic conditions is essential for preventing and protecting human health during all the infectious outbreaks, including COVID-19. The COVID-19 pandemic recalls the vital importance of achievement of Sustainable Development Goal SDG 6, that is ensuring availability and sustainable management of water and sanitation. The world of science and technology and innovation is an exciting area in which the network and interaction yield fruits. and RCSTD continue to meet and bring inspired people together in a forum like this to ensure the center remains at the cutting edge. I'm glad to see the participants from all over the region, from South Africa, Iran, Kenya, Mauritius, France, among others. I would like to express my appreciation to Mr. Sajid Malam Hassan from IORA Secretariat, Dr. Mama Holding Tegale, Dr. Kenya Shok from WRC, and to my good friend, Ms. Fereshte Moradi from RCSTD for their hard work and dedication without which this webinar could not be realized. And before closing, I would like to appeal to all the scientists and research institutes in the IORA member states and Delta partners to contact with us, with RCSTD, and bring forth the innovative answers for the grand challenge we are facing. Thank you very much.
Thank you very much, Dr. Miramani, and I'm happy that you finally sorted the technical glitch. We needed to hear from you. And then with this, we're closing the plenary session with our first speakers, who are mainly the core partners of the Water Research Commission with regards to us hosting this IORA Water Sanitation Research Innovation and Tech Transfer Coordination Center. These are the core team that works with us to make sure that we are able to do what needs to be done. So now we are going to move to the next set of presentation. For now, we've heard from South Africa's national response with regards to how our government has put together teams and structures to coordinate our response to COVID-19 pandemic. And we are now going to be hearing from 5 more countries. This is Iran, France, Kenya, Mauritius, and Sri Lanka. So the next 5 sets of presentation is going to be sharing with us how these other countries has managed to put in place some support or response mechanism for their countries to be able to survive and cope during the COVID-19 pandemic. And we will start with Iran. And Iran is going to do a joint presentation by Dr. Nasseri and Mr. Kashfi. So Dr. Nasseri is a professor at the Tehran University of Medical Science in Iran. And then Mr. Kashfi is the deputy of the National Water and Wastewater Engineering Company in Tehran. So I'll hand over to the Iranian colleagues to kindly please share your national response with regards to COVID-19. Over to you.
Hello, everybody. Based on the program, I think Mrs. Nasseri want to present his presentation first. Is it?
Okay. First of all, I'd like, do you have my voice?
Yes, we can hear you very well. Thank you, Doctor.
I'm very happy to see you because the part that you are living there, this is one of the parts in the world that I would like to come there and to see. Anyhow, first of all, I'd like to thank you for inviting me to this webinar, but I just want to have my slides.
Are you going to project from your side?
Yes.
Yes, please do that. You
because
can
have,
share the screen.
About only 7 minutes.
Okay, you can share the screen. It's okay. Are you going to share your screen, Dr. Nasseri?
I can't see my slides.
Tobile, do we have their slides with us? Tiani?
No, I do not have access.
Yes, we do. Tobile, can you please project for Nassir?
Apologies for that, colleagues. I think while they are trying to project your slides, Dr. Nasseri, you can just start with the introduction so that we don't lose too much on the time. There you go.
Okay. Okay,
Thank
it's
you,
fine.
Tobile.
Thank you so much. And can I change the faces? Yes. As you know, anyhow, our punctuation today is related to wash, water, sanitation, and hygiene. And if we go to the next slide, because I cannot do it. Yes. So it's very important because hand washing has been one of the most important items regarding public health in the world about SARS-CoV-2 and the COVID-19 pandemic. And in the next slide, I just, would you please show the next slide? Yes. And something which is very important is that we should try to have consistent applied wash and waste management in the world in all communities. And the communities are different. For example, there are houses, there are schools, marketplaces, healthcare facilities, and something I think that which is very, very important are prisons. So the responsible persons should also work in prisons regarding COVID-19. And we know that poverty is increasing in the world. Why? Because of, for example, this COVID-19 problems everywhere in the world. And the economic impacts of the virus are projected to force an additional something about 40 million to 500 million people into poverty. And based on the annunciation of IMF, International Monetary Fund, the cumulative loss to global GDP over 2020 and also 2021 could be about 9 trillion US dollars, which is really very, very great. And in the next slide, something which has been always very, very important for me has been SDG plans. Why? Because all of the 17 goals of SDG plans are related to public health in the world, which is very important. And you know that in number 6, something which has been considered is clean water and sanitation, which is somehow related to this new coronavirus. And during recently, the providence of SDGs in the next slides, you can see that in goal number 6 is, if we go to number 6, because we do not have enough time. If we go to the next slide, please. Yes, you can see that in the new providence of SDGs, in goal number C, we can read supplying disruptions and also inadequate access to clean water. Water access is very important for the people because in many parts, for example, in each country, many people maybe they do not have enough access to water, and this is very important. So disruptions and inadequate access to clean water and also hand wash facilities is one of the most important COVID-19 prevention measures. So this is very important and we should try to work on this SDG item. In the next slide, something which is also very important for all of the people in the world is the cost-effective strategies for pandemic preparedness and also for pandemic water sanitation, for example, systems. And the next one is also waste management practices. Wastewater management, why it's important? Because this virus has been found in the feces of COVID-19 ill persons in the world. So it's found, so we should also work on raw wastewater and also treated wastewater apart from water treatment systems. Here, just to mitigate the secondary impacts of COVID-19, for example, disruptions to supply chains, inability to pay the bills, which is very, very important, the negative impacts of the continuity and quality of services, and inability of different communities, schools, workplaces. And if they are not managed in each country, the secondary impacts can increase the risk of further disease spreading. Let's go to the next slide, please. Yes. So the priority areas in water sanitation and hygiene sector, one of the most important is regarding importance of safe drinking water and water resources management, also importance of hand washing practices, quantification of the presence of this virus in raw and treated wastewater is very, very necessary, and conducting training workshops. I just want to suggest that this is also very important because the people should have enough idea about virus detection, which is very important. And the next slide, please. Yes, performance assessment of water and wastewater treatment plants is also very important. And based on SSP, as you know, sanitation safety planning, it's also very important. And something that I suggest, which should be done in each country in this region, in IORA regions, water sanitation plan, WSP, is also very important. We should try to work again. If we have done, for example, WSP in one city, we should try to do it again because we may have this virus in that, for example, in raw water and WSP. So it's very important. But the last one, provision of financial supports. I think this is the most important one. And I think that each government should allocate a special higher budget for preparing clean water for all of the people in his own country. And in the next one, in the next slide, yes, in my school, in the School of Public Health, and also in my Center for Water Quality Research in IOR, we have worked a lot regarding this virus in different items. But I don't want to, I know that the time is very short. So let's go to the next slide, please. Yes, something which we have done just after the annunciation of the first two dead persons related to COVID-19 in one of the cities of Iran, I started to work in one of the most important items regarding COVID-19, and it was raw wastewater and also treated wastewater in three cities, in Tehran, Qom, and one of the cities in Gilan province. And we found that there may be some provinces which do not work very well. So based on this, on the results of this work, the Iran National Water and Wastewater Company, they are working with me in order to work more and more about having very well annunciations in this item. So if we go, for example, to the next one, I just want to say that we are going to also working on distribution systems, water distribution systems, raw water, also distribution system, water treatment plants, and also wastewater treatment plant. But in the next slide, I just want to focus on something which are also very important, apart from water and wastewater science items. Wastewater-based epidemiology, WBE, is also very important. Also, quantification of the magnitude of exposure of the people. This is very important. We should try to start with, for example, QMRA, quantitative microbial risk assessment on this COVID-19. And the last one, which you know that is very important, disinfection technologies in water and wastewater treatment plants. It may be chemical, for example, processor, or non-chemical disinfection processes. And if we go to the next one, please, I just want to say that something which is very important for me, all of the friends that are now in this webinar, regarding the role of IORA academic groups, I just want to suggest a few actions. First of all, is developing a stronger research environment for WASH, and then adding more focus on matters regarding WASH versus COVID-19, conducting research aimed at enabling better regional policy outcomes, and also developing a stronger regional policy foundation. If it's possible, it would be very, very positive for all of the regions. And the last one is enhancing collective regional awareness. But I just want to suggest all of the scientists and all of the researchers related to IORA academic groups, we should try to work together. We should try to have, for example, coordinate together in scientific studies related to water and wastewater, and also all of the items related to COVID-19. Thank you very much for listening.
Thank you very much, Doctor. And we'll just move straight, because it's a joint presentation. We'll move to Mr. Kashfi, who will also do still a portion of the Iran presentation. Thank you. Over to you, sir.
Thank you. Let me introduce National Water and Wastewater Engineering Company, which is a holding company for all of the water and wastewater companies in Iran. We have 31 provinces in Iran, and we have in each one, one company which are responsible to water and wastewater services. And we are here as a holding company responsible for policy making, financing, and technical support of them. So we had some concerns after the coronavirus pandemic. I want to categorize them in 4 categories. First of all, it was the maintaining the continuous of water supply in the light of increased consumption. The next one was insurance the health of potable water. And the next one was the ensuring the quality of treated effluents. And the last one was ensuring the health of water and wastewater sectors staffs. For the first one, I want to explain that we had at least 20% increasing in water consumption. In some cases in the big cities as mega cities like Tehran, Shiraz, Mashhad, and some other mega cities, we had more than 35% increasing in water consumption. We had some actions that taken to control demand and insurance the continuous of water supply. The first one was that we execute some project to upgrade and renovate installations. And also we execute project to increase the storage capacity. We execute some project to dig the and equip wells, and also execution of project to improve the quality of water, completion of 24 national water transmission and treatment project, and preparation and production of public training package aiming at the water saving. And the most important ones was the emergency readiness of the operational units that we had in each province. To ensure the health of potable water, although the global experience has demonstrated the inexistence of coronavirus in potable water, still the following actions were taken to ensure health of potable water. The most important ones was the expansion and equipment of water and wastewater laboratories to monitor and measure coronavirus, which is PCR real time. Measuring coronavirus in the water distribution network of the 3 major cities of Tehran, Karaj, and Mashhad, which are the most important ones in Iran. And intensification of water quality monitoring through increasing number of sampling and the relevant tests. And finally, controlled increase of the residual chlorine at some water distribution network having the high risk potential. So we have also some program on this issue, which is ongoing plan enhancing the measuring and monitoring capacity of coronavirus at other cities and villages of the country. To ensure the quality of treated effluents, some cases explained by Ms. Naseri, but I want to say that given the greater probability of coronavirus present in the wastewater, some actions were taken. Establishment of the specialized committee to review and analyze the presence of coronavirus in wastewater in collaboration with the academic sectors the most important was the Environmental Research Center of Tehran University, which Mrs. Nasser is from there. So execution of a research project to measure coronavirus at the inlet and outlet of the wastewater treatment plants in the 3 cities of Tehran, Qom, and Bandar Anzali, measuring the presence in the wastewater national and treatment plants of the 3 major cities, defining a research project to measure the quality of coronavirus and to review the impact of wastewater treatment plant on reduction and removal of coronavirus, and finally exchange of the view and specialized collaboration with other relevant organizations to review the eventual impact of discharging raw wastewater to the environmental. We had some webinars with JICA, with JCCME from Japan, with related organization in Germany, and they present some experience that they had. So to ensure the health of water and wastewater sector staff, we had some actions, notification of decisions by National Coronavirus Action Committee to water and wastewater companies, which was very important for the water and wastewater sectors, that they know just in time the notification of the decision of that committee. So preparing and notifying the internal guidelines to increase the safety of staff operation, the water and wastewater installation, and in particular the employees of wastewater treatment plants, which they are most in face of these problems, and creating the appropriate conditions for removing water of the HQ at administration of finance department staff. This was the most important actions that we can manage the problems that we face through the coronavirus pandemic, and we are going to develop it to all of the country in future. Thank you.
Thank you very much to Team Iran for sharing with us these programs that have been put in place, the research work already, because you've already touched on some of the research that is done in the country, and there are several activities that you are doing in response to COVID. I think we'll move to the next speaker, and the next speaker is going to be Dr. Dominique Dinon-Bleutier, who is the head of the Department of Biology Health at the National Agency of Research in France. And he will be sharing with us what France has put in place with regards to their government response to COVID-19. Over to you.
You have my slide, I think. If you can share my slides, I send you. Hello?
Okay, colleagues, if you can just quickly share the slides for us. Thank you.
I send you the slide in South Africa, so you should have them. So you can share it.
Yes, colleagues, Tobile, Tiani?
I can do it.
Can you kindly project the slides? Can you?
Sorry, we have just had to get out of the building. There was an alarm. So it might be that folk are still drifting back in.
Okay.
Maybe you want to switch the order.
Okay, or if maybe you are able to project from your side.
I can try it, okay?
Thank you so much.
Sorry for the delay. This is
okay, there she is. They are back.
This is here, yes, it's okay. Just full screen and it's okay. So thank you everybody for inviting me to make this presentation. I will focus only on the activities of my agency. In fact, in response of the COVID-19 pandemics, the state organized a scientific council on this pandemic, which is directly correlated to the French presidency of the state. And in this council, this council covers almost everything. I mean, clinical research, on the environmental research, social consequences, recovery of the after the pandemics. Yeah, I mean, in a sense of economy, in a sense of evolution of the environment, etc. So my agency was in charge of developing the research. We put away, we discard vaccine, which is treated in other places than in our agency. And we put also away what is happening really in hospital. This is not, we are not in charge of it. So the action we developed in our agency are the four which are indicated in this on this slide. The first answer was a flash COVID-19, which is the first call, immediate call when the pandemic, the epidemic started in France. So in March, it was opened during 1 month, and it was just to fight the start of the epidemics. Since April till October, we opened a second call, which tried to answer to the development of the pandemic, because in this time the epidemic became a pandemic, and so we are answering to all new questions linked to the evolution of the pandemic, such as the confinement, such as the recovery of economy after the confinement, etc., etc. And I will show you a little bit how we deal with that subject. And then for the next year, we add a priority, national priority on COVID-19 in the general call. And I will show you some international collaboration we can promote also. So the first call was a flash COVID-19 in March. And what is interesting is not the budget and so on, it's the 4 aims of this call. These 4 aims were based on the WHO recommendations. And 4 aims, so epidemiological studies, pathophysiology of the disease, which was at this time the more important aim, infection and prevention and control, the second aim, which was really important, and ethics and social dynamics, just to follow the evolution, the beginning of the pathology of the pandemic. Next slide, please. So the second call will cover almost the same program. I mean, the 4 aims I just described, and we had an additional aim, which is global challenge of the COVID-19 epidemics, to cover all questions which are addressed by the development of this pandemic. At this stage, for this second call, the duration of the project were really short because we didn't want to pass over 12 months. And we needed, at the end of the project, we asked for a real deliverable, which is immediately possible to put in the society, to run immediately in the society. A second aspect of this call was to develop projects which require data collection during the epidemic crisis and just after the epidemic crisis, because if we don't collect this data, we will never add them anymore, because it will be after the crisis. It's really important to take lessons from the development of this pandemic for next pandemics, probably. The third initiative was to create a priority COVID-19 displayed on INR National General Call for next year, and which it corresponds to mid and long-term project, I mean, between 3 and 5 years, because unfortunately, I think we have to deal with the development of this disease for a longer time than we expected at the beginning. So next slide. So international collaboration in COVID-19 in France. So I have to tell that our agency, INR, developed only joint program with national foreign agencies, and very few of them. We have just 5 or 6 international agencies we are following to develop this collaboration. So in this way, it means that when we promote collaboration, in fact, we promote collaboration of funded research teams belonging to foreign countries. For the moment, so you see what we did. So we had three projects in the flash, which included Canada, Italy, and USA research teams, which were funded by their own agencies. We also have a free Franco-Japanese project financed by Japan and IORA, and we are planning a workshop with China and Science Europe to promote new collaborations. Besides the IORA call, we have also INRS International Flash Call in April, on April of this year. INRS is a research national agency, French research and a national agency devoted to infectious disease such as AIDS. At the beginning, it was created for AIDS, but also tuberculosis, but also hepatitis and so on. So we had a specific call on COVID-19 in resource-limited countries. And in this call, the budget they had was possible to use to fund foreign research teams. So to promote international collaboration, I think INRS is a good office, a good tool to promote international research in this field. And I will finish on the few projects we funded on water and COVID-19. And I have to tell that these projects were not so many. Only for the moment, I think less than five projects out of more than 600 projects were devoted to water and COVID-19. Among these five, 3 have been evaluated. The first one, water curve, the subject was spatio-temporal mapping of the spread of COVID-19 for wastewater, was not funded because it was not strong enough. Quality was not there. And the 2 others were funded. It's a DISCO, Dissemination and Stability of SARS-CoV-2 in the Coastal Environment, which has been funded. It's in the west coast of France. And it's analyzing the wastewater dischargement and also the contamination of the ocean, but also of jellyfish, because we just want to see if it's possible to consume them or not, depending on the charge of COVID-19. The second one, EPICOV, it was an analysis of environmental epidemiology of COVID-19 in French Guiana in South America. And it's combining eDNA and biogeography to forecast future epidemiological waves. And these 2 projects just started 2 months ago. So this is our contribution to the field of the workshop of today. And you will see, I will not present it here, you will see the summaries of these 2 projects in the presentation you can get from South Africa office. That's what I wanted to tell. And my conclusion was also, I think it's really useful to have a holistic view of the research and not to focus only on one problem or one project, because it's easier to compare the quality of the different projects. Water and COVID-19 is an important project, but we have to see it in the whole response against the pandemics. Thank you.
Thank you very much, Dominic. I think it's already clear, we're seeing that there is really a need for the IORA member states and the dialogue partners to work together, strengthen our partnership, because there's a lot of work that is being done in our member states. And this, of course, is not only for COVID-19. As the coordination center that we are, the Water Research Commission would like to build partnerships now during the COVID-19 pandemic, but also looking at a long term as to how we can strengthen collaborations between the member states and the dialogue partners with regards to water and sanitation, research, development, and innovation. And with that, I will move over to Kenya. And the presentation from Kenya is going to be done by Mr. Jukabo Njagi, who is the Assistant Director of Research at the State Department for University Education and Research, Ministry of Education in Kenya. Over to you, Mr. Njagi. Thank you. If you can just remove your screen, Dr. Bluter. Over to you, please. Jacob, are you on? I see you still muted. Can we help to unmute?
Hello, can you hear me now?
Thank you. Yes, I can hear you and I can see you. Go ahead, please, sir.
Okay. Thank you so much, and we really appreciate for inviting us to this meeting. And what I want to say is that Kenya, like most other countries in the world, has continued to suffer a lot of impact from this pandemic in terms of the social life and also the economy. And from the Ministry of Education perspective, still running as face-to-face learning has not resumed because of the pandemic. But the ministry is making a lot of effort in trying to bring things back to normal and see whether they can resume running. There are programs that are there to support this, especially where we're having learning institutions preparing for washing points, having tanks where students can wash in all institutions. Of course, they're also we are looking for a way of how we can enhance social distancing within the institutions. So what has happened is that we've enhanced, especially the issues to do with water and sanitation. What we find in Kenya is that in most marketplaces and even institutions where we have people congregating their water tanks placed all over, even in the marketplace, where even when you go to a market, you'll always find there is enough water to do hand washing. Of course, there are challenges in some areas because of availability of water. Some parts of the country, of course, there is dry, but the many institutions, especially the ones that are responsible for provision of water, they have tried to enhance that to make sure that there is enough water for sanitation. We also find that there are challenges like when you have rains, which are erratic, and some places of the country experience a lot of rainfall. These rains sometimes cause damage to already established water and sanitation framework that has been laid. And this, again, erodes and gains that we've already achieved. Or the other challenge is that in the slum areas where you have a lot of population, provision of water, piped water, sometimes it's not available. And this now gives a challenge because most of these areas, they have to buy water. And they may not be cheap for them because, of course, the earnings are also low. That's why we're having challenges, but the government is trying to support and they provide water. Also, some non-governmental organizations have tried to come up and to boost and make sure that there's available water for drinking, for hand washing, and for sanitation. We are experiencing a lot of also innovations that are coming up as a country. We have a number of our young innovators developing hand washing machines, which are manually operated. Like you would find that there are machines now where you don't have to touch a tap or even the soap dispenser. You only need to use your feet to make the tap open and also apply the same for the soap. So there are innovations that are coming up. And as a ministry, again, we are trying to come up with the ways that we can be able to also contribute in terms of science and technology in this area. As a minister in charge of science and technology, we are coming up with programs that could also assist, especially in the area of prevention. The National Research Fund recently in May, they launched a strategic call on COVID-19. And most of the areas that the call focused on are the areas that have been identified by the Africa Task Force on the coronavirus. And these areas include the rapid laboratory testing, infection prevention and control, case management, enhanced surveillance, community communication and community engagement, rapid response and simulations, developing adaptations and innovative approaches to managing COVID-19. And we look forward as a country to engage in collaborative research, especially in water and sanitation, and especially the countries that are in the IORA association. Thank you so much. That's my contribution.
Thank you very much, Ms. Njagi from Kenya, for sharing with us what is Kenya currently doing with regards to responding to the COVID-19 pandemic. We will now move to Mauritius, and Mauritius' presentation is going to be delivered by Dr. Zobe Yumaye, who's the Senior Advisor at the Prime Minister's Office in Mauritius. And just a reminder to kindly please post your questions in the Q&A chat box, because in that way we are able to nicely respond to it, the panel, as we're moving through the program. Over to you, Dr. Jumaye. Thank you.
Thank you. Thank you, Mahmoud Hagali. And first of all, let me thank the Water Research Commission to have invited me as a representative of the government of Mauritius to speak in regard to the general response of the government of Mauritius with respect to the COVID-19 pandemic. Would you be able, please, to share my slides, if possible? So, as a reminder, I'm a doctor and working at the Prime Minister's Office. So I'll talk about the general response of the government regarding the health issues and the way that the epidemic has been handled since the beginning of this year.
If you can just pause there, Dr. Jumaye. Tobila, can you kindly project the presentation, please, for us? Thank you.
I don't think I have this one. Tiani, you can project it on your side.
If it's not a problem, and I'll continue the presentation. If there is no slides, it's not a problem. So basically in Mauritius, we have earmarked 3 dates that has been our response to the epidemic. You will all remember that 31st of December 2019, China revealed that there is a new form of pneumonia that is affecting people, especially from the province of Wuhan. And 3 weeks later, on the 20th of January 2020, China reported 4 deaths and over 200 cases. And later, on the 11th of March 2020, the WHO declared, on the 11th of March, WHO declared the COVID-19 as a pandemic. So we in Mauritius, we took those 3 dates, and our response has been multi-layered since January of this year. And as early as the 23rd of January 2020, when the epidemic was starting in China, the government of Mauritius, and together with the Ministry of Health, started sensitizing, and we started an awareness campaign on the radio, local radio, the TV, the national TV, and the written press, so as to inform the population about the risk of what is happening, what has started in China, and how the disease was propagating and what was the precautions that we wanted them to tell. So a major campaign of sensitization started so as to make people know that about the risk. And at that time, the third week of January in Mauritius, we didn't have any case, and we were expecting that this would not happen in Mauritius. Government printed posters and pamphlets that contain information, useful information that were distributed in the port and especially in the airport. And we took on board all the institutions that we deemed necessary to convey the messages that we had to convey to the population. And this first awareness campaign was based on the important measures that we wanted people to be aware of. The measures promoted was mainly social distancing, the what would become a habit and which would be enforced by law is the wearing of mask. We started to talk about wearing of mask for healthcare professionals during the month of January. So social distancing, wearing of masks, and personal hygiene. Personal hygiene meaning washing of hands. Washing of hands for everyone, washing of hands. We ask people to stop shaking hands, to limit contacts, and use as much as possible sanitizers, hand sanitizers. You may wish to know that in Mauritius, the tap water is drinkable water, water is consumable, but we recommended people, our population, to wash hands as much as possible and wash hands as soon as they got home. And a special emphasis was put on the healthcare providers so that they can learn new habits which they would have known in the past, but which we wanted them to adopt as regular practice. So at a later stage, this early message in the month of February was completed by other measures like screening at the airport with installation of thermal scanner and record of temperature for every passenger coming in. A health declaration form was filled with complete information regarding the recent travels of people, and we especially wanted to earmark and to target the passengers who have been traveling in the region of China and especially in the province of Wuhan. And so as we could monitor them more closely, the health inspectorate under the responsibility of the Ministry of Health has been able to direct its surveillance towards those people who had filled in their health declaration form and the regions which would have been defined as high risk at that time. A rapid response team had been set up in order to be able to give assistance and identify those people who would have had symptoms, travelers coming back to Mauritius, tourists coming to Mauritius, who would have suspicious symptoms and make them suspicious cases. We have set up a rapid response team who was working under the responsibility of the Ministry of Health and the Public Health Department. Their role was to manage the cases, suspicious cases, to test them and identify whether they were contaminated. These are the early measures which have been taken, and these measures were taken before any positive case has been declared in Mauritius. We had a preparedness plan at the Ministry of Health as well, and one hospital in the south of the island. Mauritius is not a big country, it's a population of 1.3 million people. We converted one general hospital into a hospital which would be dedicated to take care of the COVID-19, to be an isolation center, a quarantine center, and a treatment center as well. ICU facilities, intensive care unit facilities were provided there, And this hospital was kept ready in case of an outbreak of the epidemic. You may wish to know that all these facilities which were dedicated to the COVID-19 treatment has been equipped with treatment plants for the wastewater, and all the wastewater have been treated so as not to let the virus get into the community and contaminate other sources of water. A travel advisory has been warning. A travel advisory warning has been enforced, and passengers coming from China had restricted the incoming passengers from China were advised as from 30th of January that there were restrictions to Mauritius. Flights from Shanghai and Hong Kong were suspended early February, and late February 24 to 28, we suspended flights from Korea, from Italy, and from Iran. These were, you would remember, the places which were affected at that time. There was China, Iran, and 3 provinces of Italy. On the 16th of March, Mauritius decided to restrict flights from United Kingdom and European Union because the situation was becoming source of worry in these regions. And on the 18th of March, what we were fearing at that time happened. We got our first 3 cases. 18th of March, 3 cases were diagnosed, and the population was taken aback and we were shocked. We got 3 cases. These 3 cases were people who traveled from Europe and came to Mauritius. We closed the border on the same day, and all the people, passengers who were traveling back to Mauritius, Mauritians who were repatriated, had to go into quarantine as from the 19th of March. And government ordered a sanitary curfew, which is commonly known as a lockdown, as from the 20th of March, and this lasts until the 20th of May. So in this way, we limited contacts between people. It was a sanitary curfew, which was a very stringent one because supermarkets were closed. Only essential services were open. People were not allowed to walk on the streets. And I was saying that supermarkets were closed, but we had accompanying measures that I will disclose in a few minutes to let people know how we manage the epidemic. Our strategic response regarding health was based on contact tracing, testing and isolating, as well as treatment. So this was the global approach of the epidemic regarding health-wise. And we redeployed our hospital staffs. We increased our capacity of testing. We ordered we did massive orders of PPE, masks, ventilators, drugs, reagents, and our hotels were transformed into treatment centers. We had, at some point in time, 12,700 people in the quarantine centers, and we managed to curb the epidemic. And since the 26th of April this year, we have not had any case of COVID-19 in the community. So our communication has been chaired by the Prime Minister. We had a high-level committee that had been taking all the decisions regarding COVID-19, and myself, I was the spokesperson for the National Communication Committee, holding daily press briefing to inform the population of the situation every day. We were very transparent, telling the population about the situation, giving them all the information, number of cases, and this is how we managed to get people to adhere to all the measures that we were recommending in our sensitization campaigns. In total, Mauritius has had till date 213 cases of local contamination in the community, and the rest have been in the quarantines. We have had 114 imported cases in quarantine. The total number of cases of COVID-19 in Mauritius is 350. 55 today. So until now, the borders are closed. We are repatriating only our fellow citizens that are stranded abroad. And we are now moving towards a phase-wise reopening of our borders, which will be implemented soon. We are now COVID safe since 26th of April, and we hope that this situation will continue. I would like to thank you for your attention. I thank Mr. President Naidu and all the participants in this forum, and I think it's a great initiative. Thank you very much.
Thank you very much, Dr. Dumay. We will now take our last presentation. I see we're already having several questions in our Q&A chat box. So we'll take the last presentation from Sri Lanka, and then I'll just facilitate that we respond to the questions that have been posted in the Q&A box. So the presentation for Sri Lanka is going to be done by the Admiral Retired Jainath Columbage, who's the Secretary of the Ministry of Foreign Relations in Sri Lanka. Over to you, Mr. Columbage.
Good morning, good afternoon, good evening across IORA. It's great to be with you, and thank you for the initiative to talk about something very important and pertinent. That is basically water and sanitation science. But through that, I'll be sharing on the COVID success or COVID-19 success story of Sri Lanka. Now, Sri Lanka is hailed as one of the best or the topmost countries who had battled COVID-19 very effectively. And if I share with you some figures, we have today, as of today, we have 3,012 cases. But out of these 3,012 cases, we have different clusters. And unfortunately, we had a huge Navy cluster which ran up to about 950. And it so happened that that was in line of duty because they were trying to prevent COVID, and then they were trying to take people for quarantine, and they were infected. And then we had another huge cluster in one of our rehabilitation centers, and that was approximately 21%. In fact, in the community, out of these 3,012, only less than 10% was actually in the community. And then right now we are receiving a lot of foreign, Sri Lankans living abroad, and that cluster has gone up to 1,096, which is roughly 36.6. Now the point is that in Sri Lanka, the community spread was kept at a minimum. And also the good news is out of 3,012, 2,870 people have already recovered and gone home. And right now in active hospitalization is approximately 125 people. And that's a very good news. But I would say the best figure we have is the number of deaths as a result of COVID. It is only 12. And that's a mere 0.40% of the total number of cases we have had. And the second best news is for the last 2 months, we haven't had a single case of COVID-19 from our community. And right now we are repatriating Sri Lankans mostly, and also many other nationalities, and they are all coming back to Sri Lanka. And that is why the number of imported cases have gone up. Even yesterday, we have had about 15 imported cases. But good news is that we keep them with us. They are coming from our the quarantine center, because we have a very strict policy of quarantine, and that's one of the success stories for Sri Lanka. Now we are in the process of bringing in Sri Lankan expatriate community who had been working abroad in large numbers. Earlier, we were doing about 5,000 a month, but in the month of August, we have brought about 11,000. And totally, we have brought about 29,500 Sri Lankans from 105 different countries across the world. So I think that's a huge achievement for this small country. And despite the fact that our airspace is closed. Now, Sri Lanka became aware of this COVID-19 in the month of January, February, when actually it started in Wuhan. There were a large number of Sri Lankan students studying in Wuhan. Wuhan was the epicenter and the most vulnerable, most dangerous zone at that particular time, because it's in the Hubei province. So our government, the president took a decision to evacuate Sri Lankan students as early as possible. And I'm very happy and proud to say Sri Lanka was the third country to evacuate Sri Lankan students from Wuhan after America and Japan. So we were there at the top at that time also. Now, another good thing that we did immediately while we were evacuating people, or while we were evacuating the 34 Sri Lankan students, we started quarantine centers here. And we found that, our mechanism did not cater for quarantine centers. So we decided the army should be given the responsibility. And I'm very proud to say, so far, the army has maintained gold standards in maintaining a quarantine center, not a quarantine center. As of now, there are about 7,000 people who had actually come back to Sri Lanka are undergoing quarantine. And also another great thing we did was in the beginning, that is 26th of January, when the president came to know about the COVID-19 and the possible spread to the world, he appointed an action committee which was consisting of the scientists, the doctors, and the government officials. No politicians in that except one. Of course, we had the Minister of Health, and all the officials and scientists and doctors. So they formulated the policy for combating COVID-19, and that is the main reason for success. Of course, later on, in about April, this action committee was elevated into a COVID task force. To date, the COVID task force is functioning, and I must say that I'm also a member of that COVID task force. Now, the Sri Lankan strategy, number one, was prevention. We were focusing on prevention of the COVID-19 coming into the country, prevention of COVID-19 spreading to the community, and that was our number one. And there again, the second one, not necessarily in that order, but life matters, because we kept life, the human life, the value of human life above the human liberties. Because if we tell the people there is a virus, please take action, many they will not. We said, okay, there is something like this. We are not going for a lockdown. We may be having a curfew. Please restrict yourself to A, B, C, D, and people obeyed. So the strategy really worked because we were focusing on prevention and life matters, not the human liberties. Well, it was a humanitarian mission, and our total strategy rested on three pillars, that is testing, tracing, and treating, because the testing was very important, and Sri Lanka was not geared for testing, and initially we were testing about 10 PCR testing per day, but right now we have gone up to about 2,500 tests per day. Now we even have a laboratory at our international airport. So we initially did the testing. The moment we did the testing, the tracing was important. Contact tracing, the first ring, the second ring, the immediate ring, so on. And for that, we did not have all the technology in the world, but we combined human intelligence, that is through our public health inspectors, public health nurses, grammar, the village officers, and also the intelligence, the police. And they got together and combining technology, they were very effective in contact tracing. Now, once we came to know that the virus had come to Sri Lanka, then the second stage, we were focusing on restricting the mobility. We identify the vulnerable district, we identify the buffer district, and then we identify the clear district. And we restricted the mobility of people to these three districts, and we exercised that for a while. And it actually prevented, because there were no cross-border movement even within Sri Lanka for quite a long while, and schools and universities were closed, and we brought this concept, stay home, work from home. Even today, we practice work from home, although most of the time we are in the office now. Well, when we went for work from home and the stay home, there were so many issues because there were daily wage earners. How do we cater for them? Because we had to look after them. So the government introduced a relief package of 5,000 rupees per family per month. And even the medicine was sent to the home. There are sick people who cannot go to the clinic. So then they were distributed to the home. Now, then also the hospital, because initially we were very worried because we had only one infectious disease hospital, which had about 12 beds, and we didn't have enough ventilators. We didn't have enough ICU beds. So we was really worried. But then later on, we went to create about 12 dedicated hospitals. But the good news is we did not even have to use all the ventilators we had because there was no need to it. And the ICU beds are plenty available still. And of course, we received a lot of support from our friends across the world. India supported us with a lot of medicine. They actually sent 2 plane loads of medicine. And China supported us big one. Only 1 plane load, but then second one was coming. Then South Korea offered the test kit, and many countries, America is giving us 200 ventilators. So we did receive a lot of support from across the board. Now the COVID is a success story, but then beyond COVID, what next is the next question. Because while the COVID was going on, we realized that our economy was going to suffer immensely because it's linked to the global economy. There were disruption in the global supply chain. So then the president took the initiative to appoint various task forces or various committees to study about reviving the economy, reviving agriculture, poverty reduction, economic development, reviving small and medium enterprises. So somehow we kept the economy going. And of course, I would say put the leadership, the political leadership and the civil military relations and working or getting the best from the experts, the scientists and the doctors as success stories of this battle with the COVID-19. Now we are grappling with I would like to say post-COVID world, but it's not yet post-COVID world, although we have really battled against COVID very successfully. Now the world, how the new world order will behave, whether it is globalization or whether we will slow things down. How are we going to overcome the disruption to the supply chain? Now this has given us rethinking about our economic model, because we were really worried about concentrating about an import-based economy, but we want to change track to be an export-led economy. Now, in this, I think as far as regional cooperation is concerned, the IORA is a huge region. I think one of the most critical regions in the world in the 21st century, and we have a huge, large population. I think IORA should work on 2 things. Number 1, food security. That means we should have sufficient food for IORA members. The second is medicine security. These are the 2 things that I would request IORA to focus. Of course, water and sanitation is very much important for our health, but going beyond that, IORA should really work hard on food security and water security, because there may be, we never know, there could be another calamity, there could be another disaster. And when that comes, if that comes, we should be ready, because we learned the lesson the hard way. We didn't have enough medicine, we didn't have enough PPEs. But now, of course, we are making our own PPE and exporting to other countries as well. But we never thought about that earlier. So therefore, I am recommending very much, of course, there are many international organizations. But even before the World Health Organization declared this a pandemic, Sri Lanka was acting, and we were proactively taking necessary action to prevent it, and that is the success story. So the regional integration is critical. IORA can play a role in food security and also medicine security. I think that would really mitigate or that would minimize our vulnerability for such an unforeseen, unlikely eventuality. And Sri Lanka is committed to work with IORA members. Sri Lanka is committed to work with all the members in IORA to achieve that task, the medicine security and food security, while maintaining all other links within the IORA region, especially on maritime security, designing maritime policy, countering maritime crime. We are very much committed to do all that, but COVID has given us new thinking. So I really wish IORA can take this up. And I really thank you. I'm sorry I took 2 minutes more than allocated to me, but I really wanted to share my thoughts with you. And I'm so happy that I got this opportunity, and I'm only 1 week old in this job. So thank you very much. Good luck to everybody.
Thank you very much, Mr. Columbage. And of course, no problem for taking the extra 2 minutes with that passion. We really enjoyed your talk. And I would like to just thank all the speakers, of course, they were exceptional, all of them, the plenary speakers and the speakers that shared their country's responses to COVID. It was really insightful. There's a lot of learning that can be happening between the member states so that we improve our COVID responses as countries within the IORA member states. We are now going to just quickly look at, then apologies, I'm going to just take extra, not more than 10 minutes of your time, just to pick on the question quickly, and then I'll do some closing remarks. And then I'll just like the speakers to please remain on board, do not log out, because I want us to take a group picture of the speakers at the end of the session. So for now, I'm going to quickly look at the Q&A chat box. I see there were 2 questions from Prashin, who posted it's more to South Africa, and I see the CEO of the Water Research Commission has responded to the question, so everyone can access this question. But the questions were about, the first one was about if we can use the disinfectants for the wastewater treatment works to eliminate the COVID virus, and the CEO there did mention that yes, of course, but it depends on it depends on the concentration, of course, of these disinfectants that you can use. And the second question, again, to South Africa was with regards to the activities that happened in our rivers, saying that based on the fact that some of the rivers are really having pollution due to the raw or treated sewage, is it not maybe better for us to stop the activities within the streams, the river streams, so that we try and minimize the infections? But then I think the CEO, designate, responded saying that, as you all know by now from the South African speakers, we are now in our level 2 rules or lockdown. And he was just said that, I mean, we need to minimize as much as we do with all the other things that are happening with regards to social activities in the country. However, it's also very important that should people want to be having these activities, to be using high quality PPEs. And there was another question, the third question that came, although in the chat box, it is asking any of the speakers that have spoken today from non-South Africa, because the question is asking if you are aware if any of your countries are having national surveillance programs. This is wastewater surveillance program. In South Africa, we do have the program which the WRC is running. So the question just wanted to know if there are any other countries between in these countries that have presented today doing the surveillance program. I think those were the questions that I've picked up from the Q&A and the chat box. And if we can just give the floor to any of the panelists, if you are aware if your country is having a wastewater national surveillance programs, so that we can respond to the last one. But the other 2, as I've said, were responded to by the CEO of the Water Research Commission. I'll pause a bit and just open the floor to the speakers, or all of the speakers, if you'd like to respond to the wastewater surveillance program for your country. Thank you. Anyone who would like to take up the question? Going?
May I answer?
Yes, please.
Your question?
Yes, please, Dr. Nasiri, you can go ahead.
Okay, the first question was about how much, for example, chlorine we should, how much we should use, for example, chlorine in wastewater or water disinfection systems. Really, it's very important, the amount of chlorine that we are going to be used. It's related to the quality of water, it's related to the quality of wastewater. And something which is also very important is that from chemical, we may have, for example, non-chemical systems such as UV systems that we can use in water and wastewater systems. Regarding the second question about rivers, the persistence of SARS-CoV-2 in different areas is related to many variables. For example, in water resources, in rivers, and even in groundwater resources, it depends to different variables. For example, it depends to temperature, it depends to the quality of water, it depends to the biological or chemical materials which exist in water or wastewater. So it's very important to work on raw water systems in water resources, because even, for example, in soils, we may have it, okay? But it depends to different variables. So in each region, we should try to work regarding water resources and also treatment water systems and wastewater treatment systems, such as something which is very important is the treated wastewater, because we should try to have enough information about the quality of the treated wastewater, because it may be used in different soils, in different, for example, agricultural actions. So it's very important to work on it. So regarding the rivers, it should be worked regionally, okay?
Thank you very much, Dr. Nasiri. Any panelists or other speakers who would like to say anything regarding your country's programs, if you have any with regards to wastewater surveillance programs, before I do the wrap up of the session and close the meeting? Just pause for a few seconds. If you'd like to also respond into the chat box, maybe the speakers to share, if you do have a program, you can please feel free to do that. Just seeing another question popping. Okay, that was a thank you. So with that, I think what I'll do now, I'll just try to wrap up the session and then we close it so that we don't take most of your time while my speakers are still waiting, because as soon as I close, I'll like to still have you on board so that we take a group picture. So I think it was thank you so much to all the speakers from the plenary session, as I've said, and also the speakers who shared information about their respective countries' responses with regard to COVID-19. I think there was a clear similarity in the way we're responding as IORA member countries, be it from the curfews, be it from the use of PPEs, the emphasizing of the good hygiene with regards to us beating COVID, the types of partnership that has been put in place, and also from several of the countries, you've mentioned the issue of the importance of research and innovation in us responding to this COVID-19. And this thing, I really liked it a lot because you've touched a bit on the kind of work some of you who are doing in research and innovation regarding COVID, but also importantly to say this is, yes, we are now dealing with COVID as the IORA member state and the dialogue partners, but we need to really strengthen our partnership with regards to research and innovation so that we can respond to this COVID, but also beyond, look at issues of water security, issues of food security, and many others. So there is a clear interest for us to strengthen our research, innovation, collaborations and partnerships through the academic group or with other partnerships, which I think is what this coordination center will try to do as we move forward, because there's a lot that we really can do together to share what is currently existing, but most importantly to also address the kind of challenges that we are still having as IORA member state and dialogue partners with regards to SDG 6, which is access to water and sanitation. And with that, maybe also to mention that we are already planning our second webinar, which will be held on the 30th of September. And in that webinar, we will be talking more about the specific programs and projects. This is the research and innovation programs and projects that the countries are running, the IORA member states are running, either to kind of have the knowledge, new knowledge with regards to COVID, but also working towards a long-term really view of wanting to have the member states that are really water secured, we are able to achieve the SDG 6. So with that, I would like to thank again our co-host, the RCSTT, Dr. Mirimadi, the Department of Science and Innovation, the DECO in South Africa, and the IORA Academic Group, and really thank all our excellent speakers for well preparing for this session and sharing with us your views, your thoughts, your experiences, and your lessons. And we look forward to having, of course, also the questions that we have received and the communication that was going through the chat box. We really appreciate that. And of course, we look forward to your participation in the webinar on the 30th of September, where we will be talking about the programs now, the research and innovation programs and projects that are being implemented by the IORA member states and the dialogue partners. In the chat box now, I've just added an email address for Tiani Chauke, who is my colleague, and he will be able to share with you the program and the invitation if you have not yet received of the webinar that will be held on the 30th. And if you need any other information regarding today's session, please contact Tiani Chauke in that email address. And then lastly, to say that this session was recorded. So the recording will be made available to all participants, including our speakers, together with the program, the biographic again of the speakers. And for the speakers that would like to really allow us to share your presentation. So we'll also share the presentation. So you'll get the recording, you'll get the presentations, and also the short bio and the program of this session soon, hopefully not later than the end of next week. And with that, I would like to say thank you all. And we close the meeting. While the speakers can please just put on your videos, all of you now. And I'll ask Diani, Fereshte, Tobile, Zama to help us to take a picture of the group of the speakers, please. So if all the speakers could kindly put on your videos, and then we take this picture. I'm not seeing all. Yeah. Kindly put all your I don't see Mampe. Oh, Mampe is there. Zama, Tiani, Dominic, are you still here?
You close my video. You have to do it. I can't stop.
Colleagues, I want to be next on the picture, so I'm not going to take the picture.
Okay.
I'm assuming
now
that
it's okay.
The picture for us. Thank you very much. We have everybody smile nicely from the camera. 1, 2. Thank you so much. I hope colleagues have taken enough pictures for us. And with that, I'd like to close the session. Thank you so much for your contribution. We look forward to your participation in the next webinar on the 30th of September. Thank you and enjoy the rest of your day.
Bye.
Thank you very much.
Bye.
Thank you. Bye-bye.
Bye.